Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Today I'm joined by Dale Shreve, President and CEO of MHCA, Mental Health Corporations of America, a national business association of select organizations that provide behavioral health care and/or related services. Dale joins me today from HQ, his HQ in the other side of Florida, Tallahassee. How you doing, Dale?
Good, Charles. Good to be with you.
I just wish people could see what I see, your background. That is a very colorful, eye-catching background. Could you possibly put that into 30 words or fewer?
It's a I don't know. It's like a whole Crayola box got all scrambled up together there. We designed that during COVID when we were doing more things virtually and decided to just sort of make that part of our brand to have that as our virtual background.
Yeah, no, it's colorful. It puts you in a festive frame of mind, which may or may not be a good thing depending on the topic at hand. Anyway,
Yeah.
Dale, I really do appreciate you spending some time. So, maybe if you would give our listeners some background on MHCA, your role, and then we can back up a little bit, tell us a little bit about your background, and then we can get to some of this other stuff.
Sure. MHCA, Mental Health Corporations of America, is an association of about 150 provider organizations. And I think we're in 36, 37 different states right now. The one thing all of our members have in common is they provide some amount of direct behavioral health care. We just celebrated our 40th anniversary, the end of February. We are, I think we focus on the CEO and the C-suite staff of our member organizations. So our goal is to really provide that executive development piece for behavioral health care leaders across the U.S. So we do that through conferences. We have 4 conferences a year that are 2.5 days in length. The content is all CEO relevant. Attendance is not exclusive to CEOs. We encourage organizations to bring other C-suite staff members because we believe that there's a lot of good content there that should be shared among the top leadership. But Charles, the real secret sauce of MHCA are the relationships that develop between the CEOs, the C-suite staff of our member organizations with their peers from across the country. So while the conferences provide that educational content and keynotes and workshops, et cetera, the real value, the real learning, I think, comes from those discussions, conversations that individuals have with each other, and how those are leveraged then into strategic and personal relationships that help them as leaders and help their organizations grow.
All of that stuff really matters.
Yeah, so I think that the organization has evolved over the last 40 years, but right now I think that that the real focus is on developing that leadership component of behavioral health care C-suite members.
Yeah, and I think the peer-to-peer focus of it is probably what makes it particularly powerful. I've been involved with organizations like this, and I've seen that, for myself, that just the getting together, the being with your peers, and what gets sparked just on a very human level when people get together.
Right. Yeah, we're small by design. We have about 150 member organizations, so conference attendance is somewhere between 150 and maybe 300 at the most. And then meeting 4 times a year. A small group that gets together frequently just really helps to foster those kinds of connections that evolve.
What did you do before this?
I worked in behavioral healthcare organization in Toledo, Ohio. I started there way back in '79. And then in '99 became the CEO of that organization. So I've been in behavioral health care my whole career. Uh, and when I was in Toledo, our organization was a member of MHCA. So I've been a part of MHCA almost since its beginning. And it's just been a really valuable piece of my professional career.
In all that time, I just want to focus on maybe the last 5 years, because it seems to me that the last 5 years are pretty consequential, have been pretty consequential on several levels. So just looking back over the past 5 years, what have been the most significant changes in your field?
Yeah. Well, I tend to mark everything by pre-COVID or post-COVID. So I'm assuming that this last 5 years really gets into my
Yes,
post-COVID framework.
I didn't want to put it quite that way. I wanted to give you the option of going well before, a little
Yeah,
bit after, try to keep these open-ended, Dale.
yeah. I think over the last 5 years, probably one of the most dramatic things is how quickly the industry pivoted to be able to do things virtually. Everybody had a strategic plan for doing telehealth and getting more virtual kinds of things in place, but COVID really pushed that agenda, and instead of it being something that was going to happen in year 2 or 3 of the strategic plan, it happened in the next several weeks. So I think that the whole piece of that virtual access, the workforce changes that happen because of that, I think have been consequential.
Has
Just
it been a net positive?
I don't, I think probably a net negative in terms of qualified clinical people being connected to organizations. I think that with COVID, they found other places to go, and maybe into more private practice kinds of settings or things where they felt they had more control than they do working for a um, community-based provider of primarily services to chronically mentally ill. That you really need a lot of that in-person connection to be as effective as you can be. Where treating more of the private practice style client, the virtual piece could work for that. And so I think a number of people chose to stay home in their jammies and
Right.
and do.
So what are you as an organization doing with the members to address that? It sounds like a real
I
problem.
think that each organization in their own market have different approaches for dealing with that. I think that there's a lot that some are doing to do have a better connection with the education systems and trying to connect early on with potential future staff. I think that there's some hybrid kinds of arrangements that our organizations have been able to put together so that they can provide some of that virtual flexibility to their staff. I think the other piece that's been more prominent over the last several years has just been the incorporation of AI and how that has contributed to service delivery and administrative kinds of things, and what our members are doing to use AI to address some of the workforce challenges, the
Mm.
productivity issues, the documentation restraints, et cetera.
Yeah. Do you have any reservations about that technology? I mean, I know that there are quite a few.
Yeah.
So I don't mean to ask that in a negative, or excuse me, a naive way. I know that there are inherent problems. We're all aware of those. Are there any things
Yeah.
that your people, the people, your members are coming back to you with?
No, no, I think everybody is cautiously optimistic about what AI can bring. Of course, there's a lot of concern about some of the downsides and what some of those risks are. But I think for the most part, our members are seeing this as a tool that they need to embrace and find the most effective way of incorporating it into their operations.
On the MHCA website, you have some principles and some interesting language talking about your goals and your organizational mission. one thing caught my eye, quote, advancing innovation and entrepreneurship in behavioral healthcare, end quote. What do you mean by entrepreneurship in this context?
Yeah. Yeah, Charles, I think that, oftentimes innovation and entrepreneurship, sort of get interchanged. I think that what we're looking at is the combination of the two. The innovative, the creative piece of coming up with a new, better way of doing something, coupled with that entrepreneurial or business development side of things, to be able to take that new idea, that new method, and build a business, build a service delivery process around that can be efficient and effective. So I think it's really encouraging members to be creative and finding solutions, and then building those solutions into a framework that's sustainable.
Something else you had on your website, and I quote, the challenges presented by a transforming healthcare delivery system, end quote. Um, we talked about one of the challenges, which of course is on the supply side, people leaving the field. What are some of the other challenges? And by the way, what I'd also like to ask you, so we talked about supply side. What about the demand side?
Sure. Yeah. No, I think that the demand is increasing. Yeah, the stereotypes that may have limited people seeking care in the past are being, more diminished. So I think there's more general acceptance of the need for behavioral health care services. And so I think our members are seeing, that increased demand. And then, we can go back to COVID again, and just some of the conditions that it created, and, again, a lot of attention on youth, but some of the fallout from COVID, and how that has resulted in this um, increased demand for services. So I think that on the demand side, that's increasing. As always, on the supply side, revenue is always tight. That's always been an issue, and with healthcare transformation and changes happening um, all the time, uh, and especially, I guess, within mental health, behavioral health care, most of our service providers are heavily dependent on Medicaid, which is, largely driven by state initiatives. So you've got, 50 some different models for how to deliver Medicaid services to behavioral health clients. And so there's just all kinds of variations for how people put things together, how people get paid for that. So those logistical, accountability, regulatory challenges that are there, um, coupled with the need to look at integration of care with primary health care and how to get that done. Many of our members are, embracing the CCBHC model, and even looking at how to combine that with an FQHC delivery. So a lot of those kinds of developments within the industry to try to um, again be sustainable and have a way to meet this growing demand, while typically the funding, the resources are limited.
We've put out, we have a Substack called Catalyst Substack, and we put out several columns to shed some light on how Medicaid works, but more to the point, all these things that it funds and supports and the good that it does, because people have a very narrow conception of what Medicaid is, and how broad-based or how widely dispersed the money is, and for all these initiatives that are really vital. And we have numbers to support the efficacy, the ROI on those Medicaid numbers. So, I think that's also an important part of all this. Everybody sort of has to put their, oar in the water and pardon the mixed metaphor, but bring some of these things to light.
Yeah.
Um, I want to ask you again, on your site, one of the principles you list is your belief in lifelong learning. Any initiatives, programs that your organization promotes as far as that? And I wonder to what extent that sort of plugs into what organizations need to do to retain and develop their people to keep them in the fold
Yeah.
and give them less incentive to go elsewhere.
But that's a good question. I think that, our approach to quote lifelong learning is what we're trying to do with our conferences and providing a setting for our member staff to engage with thought leaders, to engage with each other, to continue to enhance their skill sets. I think that, they all, I don't know of any CEO that has a continuing ed requirement, if you will. They don't have to get licensed to do that, but they all see value in keeping current with not only industry trends, but leadership skills. And so I think that are encouraging them to stay current, to be the best leader they can be for their organization, and then to bring their junior leaders along with those same experiences would be where we're at. Once, I'm not sure that lifelong might be an exaggeration. I don't think we do too much for like retired people to continue to engage in that. Although we offer retired CEOs the opportunity to continue to attend our conferences,
Well, that's good.
but
Yeah.
but we so it's really while they are actively engaged, we want to be as supportive as we can be with that educational development.
So I'm going to ask you one last question, possibly two, but one that immediately comes to mind. You said you began practicing in 79.
Right.
So looking back, what's the thing you like most about your job, your work?
Yeah, I think that it has provided. I mean, I've always been on the administrative side. I've never been a direct service clinician, so I haven't had that
Was
direct
that just
experience.
by inertia, how you fell in, or that was by design?
By design. I've got an MSW, but my MSW from University of Michigan was all focused on the administrative side of thing and not clinical. So when I came out of school, I had more background in the business administrative side of things than the clinical side. And
And is
actually,
it because that was more interesting to you?
yes,
Okay.
I felt that yeah, it was sort of serendipitous that I went in that direction. Initially thought I wanted to be a psychologist. And now I'm very glad that I switched and got more into the administrative end because I think that it suited me better. And that's actually how I got started with that organization in Toledo is that their CEO at the time was a clinician and didn't understand, didn't like the administrative stuff. And so I was able to sort of slot in and provide that kind of resource. But I think that being involved with behavioral health care, and again, I've always sort of, I guess I've been interested in people um, and why they do what they do. And being in this administrative role has given me the opportunity to I hope, help improve people's lives, both the clients that we serve, that our organization serves, and making sure that those services were the best they could be, but also then as an employer and being able to provide the staff with a good workplace, someplace where the organization was seen as an employer of choice.
What makes you most hopeful about the direction of this industry, behavioral health, mental health?
I think the probably the underlying ideology of the leaders in the industry. I think that they are, for the most part, looking at how to integrate mission and business and how do you deliver a mission-driven service in a way that is financially sustainable, feasible. So I like that kind of approach where the leaders are realistic about what they can deliver and making those kinds of changes to how practice is done. I'm encouraged by that future development. I think that what we're seeing is many of our new CEOs really bring that business mission balance, and I'm pleased with that.
Excellent. Excellent. Actually, Dale, one last question.
Okay.
Any relationship to Michael Shreve, the percussionist or former percussionist with Santana?
No, not that I know of. Not
Okay.
that I know. It's not a very common name, so you'd think that I should know every Shreve there is, but I don't think we're related there.
Okay. Well, you know what? If you come back on the podcast by that time, maybe we'll, get to the bottom of that.
I'll do some more genealogy work and figure that
Please.
out.
Please. Anyway, Dale, again, I do appreciate the time. It's a great conversation. Much
Thank you.
appreciated.
Thank you. Appreciate being with you.
Today, I spoke with Dale Shreve, President and CEO of MHCA, Mental Health Corporations of America, a national business association of select organizations that provide behavioral health care and related services. Dale spoke to me from his headquarters in Tallahassee, Florida. This is Charles Epstein from Southeast Florida, more specifically Boca Raton, signing off for the Catalyst podcast. Thanks for listening.